Well, good afternoon, and thank you so much for the opportunity to present our idea to you today, which is the creation of an Acuity tool for the ambulatory oncology infusion units. My name is Julie Cronin, and with me today is my partner, Kristen Nichols. Nursing burnout is a major issue in healthcare today that cannot be underestimated or overlooked. And nurses are burned out for a variety of reasons, but mainly due to heavy workloads, increasing patient volumes, and increasing patient acuity. And so often nurses just don't have the resources that they need to do their jobs and are dealing with nursing shortages and support staff shortages. In fact, in a recent study conducted by the Oncology Nursing Society, 62% of oncology nurses cited that inadequate staffing was the biggest issue in their practice today. All of this leads to stressed out nurses who are doing workarounds and cutting corners and putting patients at risk for potential errors. So let's meet Sarah. Sarah is an infusion nurse working an 8-hour shift, and she's scheduled to have 7 patients today that are receiving a variety of chemotherapy, immunotherapy, and blood products. So it looks like a very manageable day on paper can quickly become incredibly overwhelming and stressful. For example, today, one of Sarah's patients took 4 attempts to place a peripheral IV, which added about 20 minutes to Sarah's workload. One of her patients needed assistance to ambulate to the bathroom multiple times, and there was no medical assistant available. One patient needed an interpreter as she was Mandarin speaking only. And then another of Sarah's patients had an adverse reaction to her chemotherapy and required rescue medications. So all of these added a significant amount of workload to Sarah's day. So the problem is right now there's no evidence-based, valid, and reliable tool that would measure Sarah or any infusion nurse's work effort. So you can see here, this is a real-life example of my colleague Kristen, one of her nurses, scheduled to work an 8-hour day and have 7 patients, something that would look very manageable. But if we break it down and look at the work effort that would be needed to safely take care of these patients, we're looking at 9.3 hours of RN work to be done in an 8-hour shift. So current Acuity tools would classify this assignment as a 19 out of 20, but we know that that number is sort of arbitrary, as clearly as doing 9.3 hours of RN work in an 8-hour shift is not manageable. So this leads to things like inadequate staffing and very unbalanced patient assignments, increased patient wait times, and again, increased potential for safety issues and errors as nurses are rushing. Luckily, we've already developed a minimally viable product that's undergone initial testing, and we've used time studies to validate this tool. So ultimately, our goal is twofold. One is develop a software program that we can schedule a patient into a chair for the time that's required for their infusion, and also to schedule the correct amount of nursing time needed to care for a patient. So our tool will provide data that will determine appropriate nurse staffing models and balance that volume and acuity and mitigate potential errors. So far in our journey, we've created a minimally viable tool, as I mentioned, and created time studies to understand the infusion process from end to end with a very interdisciplinary focus. And what I mean by that is we've collaborated with providers, pharmacy, nursing, lab techs, front desk, clinical research coordinators, and more to understand their workflow as it relates to infusion workloads really from start to finish. And what's one way that we know that our nurses are very passionate about us finding a solution to this problem? Well, we created a worksheet that identified predictable and unpredictable factors, and we asked nurses to fill it out throughout their shift and let us know what was adding time in their workday and adding to their workload. And in 1 month, these already busy nurses filled out, and we received over 750 responses. So we know our nurses are incredibly passionate about us finding a solution to help them. Our key performance indicators will be in the RN work environment, patient satisfaction, patient safety, and decreased wait times, which we can extract from the EHR, and we have baseline data for this. In the competitive space, our team sat down to identify key features we would want our desired solution to have to solve our problem. We then developed a rubric to evaluate the effectiveness of existing tools in the market, and we observed 5 demonstrations and evaluated these tools, but really no other tool measures nursing workload, and this is how our tool will be very different and effective in solving this problem. So again, there are really no tools like this on the market. Our tool can be used in any ambulatory infusion unit and has the potential to positively impact thousands of nurses and millions of patients, again, ensuring that more nurses are doing 8 hours of work within an 8-hour day. So we plan to pilot at our academic medical center and community hospitals, and then expand to the 7 other MGH infusion centers. You can see here we have a very well thought out and planned budget, and we're asking for $143,750. We've already had initial meetings with contract developers who we've received a quote for the initial scope of work, which is included here. MGH will cover patents and licensing, and in years 2 and 3, you can see will be focused on maintenance, enhancements, and then initial and broad scalability. We know that a major gap in healthcare is that we don't know how to quantify nursing effort, but we have an amazing team who's going to support us on this journey and in this endeavor. Barbara Casciavelli is our executive sponsor. She's an associate chief nurse at MGH, and we have been working and will continue to work with the Center for Innovations in Care Delivery to continue our development. And then in years 2 and 3, our institution will assist us in securing a commercial partnership to develop a scalable tool. So as we check back in on Sarah, following the successful implementation of our Acuity tool, Sarah is now doing 8 hours of work in her 8-hour shift. She's not making any mistakes, no errors, and she's not taking shortcuts. So she's working in a safer environment. Her patient's experience has been improved, and they're experiencing decreased wait times. And we believe this is the beginning of quantifying nurse work effort in healthcare, something that has not been done before. This is our incredible team comprised of myself and Kristen representing nursing. Collectively, we have over 28 years of oncology nursing experience. Barbara Casciavelli is also a longtime oncology nurse and is our executive sponsor. Dr. Phil Saylor is the medical director of the Infusion unit at MGH and our physician representative. And Cameron Crow is our pharmacy manager, and he's representing pharmacy in this endeavor. So in closing, I just want to say thank you so much for this opportunity. And thank you for your time and consideration. We're happy to answer any questions you may have.